Hi, good afternoon. My name is Lisa Durkin, and I'm the Deputy Director of Human Resources Operations. Welcome to your 2012 benefits presentation. We have some new items to go over with you today, and so that's why we felt it was so important that everybody do come to a presentation and learn what is new for the benefits offerings in 2012. There are some things new and some things the same, and we want you to really understand what's going on when you walk out the door today. However, you probably won't understand everything, because nor do I, when you walk out the door today. So if you feel like you have questions afterwards, and I'm going to take questions at the end of the presentation, but if you still feel like when you're walking out today you still have questions and still need clarification, I want you to email benefits at benefits@cuyahogacounty.us. And we really want you to email instead of call there, so that we have a record of your questions and a record of what we're talking about, all right? For both us, but more importantly for you as well. So we're going to talk about open enrollment today, which started yesterday, so everybody can even leave here and go do your open enrollment if you wish. We're going to talk about what's new and what's the same. We're going to talk about healthcare reform changes that you're probably pretty used to, because they all pretty much happened last year. We're going to talk about some voluntary benefits and how to enroll in those. So, open enrollment started yesterday on Halloween. It goes through November 18th. And everyone must actively go online and do your open enrollment process. Now, even if you're not going to select benefits with Cuyahoga County, we still need you to go online and decline those benefits. And that's very important, because for those of you who don't go in, and I know there aren't going to be any of those persons in here, but if you don't go in, we are going to give you our wonderful Metro Health Select plan, and you'll be paying for that all year. So we want you to go in, even if you're not getting benefits with Cuyahoga County, and actively enroll. You're going to benefits at cuyahogacounty.us, or how many people go on to MyHR and sign in and out every day? That's where you're going, and you'll see the button. Just click on the button, and it's the same process as it has been for the last 4 years, and pretty user-friendly. If anyone here has forgotten their employee ID, those of you who aren't on MyHR for timesheets yet, you can ask your HR representative that's in your agency, and they will have that employee ID for you. So, if anybody has a hard time using that, please contact us, preferably via email. When you go through the benefits process, you're going to make all of your selections, or decline all of the selections. At the end, you are going to get a confirmation notice. This is the only time in your life that you'll actually hear me say these words: print this piece of paper and keep it. I'm the paperless guru in the county, so you'll never hear me say that, but this time I want you to print it, and I want you to keep it. And you also can email it to yourself, but even if you email it to yourself, print it and keep it. You must have your confirmation, because on January 1st, or January 10th more like, if you get cards in the mail from some insurer that you swear you didn't select during open enrollment, the first thing that we're going to say when you contact us is, show me the confirmation. And if you can't show the confirmation, we're going to say there is nothing we can do. Print and keep this in a very safe place, everybody, please. So, I'm sorry, that's your confirmation. So what's new? Well, what's the same? All of your providers are the same. So this year, we're still going to have United Healthcare, Medical Mutual, Metro Health Select, Union Eye Care for Vision, Guardian for Dental, Caremark for prescription drug, and we will still have the Kaiser Classic plan. So those are staying the same, all of your healthcare providers. The Metro Health option is still staying the same. That is your free plan. There is no premium payment taken out of your paycheck biweekly for this plan. And there is no deductible or co-insurance of any kind associated with this plan. The biggest thing you pay on this plan is like $5 copay every once in a while, and not even for everything. So this is the free plan to county employees. So if you want to enroll in this plan, you go online and you enroll in this plan, and that is a closed provider, which means that you will get all of the Metro Health services directly from there. Now, the good thing about this plan is that we do have what's called a concierge agreement with them. We have this appointment line for county employees to call up and make their appointments, and you are guaranteed an appointment within 5 days. So that goes for both their primary care physicians and all of their specialists as well. Also, if you go to Metro Health to fill a prescription, although you can also go to CVS now, but if you go to Metro Health and you stand at the back of the line, which you might feel bad about, and wave your county ID at them, they'll put you at the front of the line, which might not always make us feel good, but it's there if you want to do that. So, Guardian Dental Plan, there's no change. Vision, there's no change. The life insurance and such, there's no change. The flexible spending accounts, there's no change. However, everyone who gets a flexible spending account or who elects a flexible spending account, how many folks is that in here? I do. Who else? A medical spending account or a dependent care spending account? You have to enroll in those every year. So just because you're currently in it, when you go through open enrollment, you have to elect that again and put the amount of money that you want deducted from each paycheck in there, or it won't keep happening. That is not an automatic thing. You have to elect that by law each year. So we do have some changes to the other plans. So Metro Health is the plan that is staying the same. This is the part of the presentation where everybody gets real quiet, looks at me for a really long time. There's some terminology that I want you to know before we go over the plan and start talking about it. I want you to know what a deductible is. A deductible is the upfront amount that you are going to pay or satisfy in payments before your insurance is going to kick in. Co-insurance is the percent of a medical procedure that you're going to have to pay for. And once you've satisfied that deductible, you are going to be responsible for 10% of your procedures, up to a maximum out-of-pocket, which we're going to talk about the amounts in this case. When you reach this amount, you're covered 100%. And you all know what a copay is, right? We've had those on our insurance plans for quite a while. The copay is that $20 that you currently give whenever you go to the doctor's office. So this is terminology that I want you to be very familiar with and that we need to learn how to use as well. After we're done here, this presentation is on my HR. You can go and get this presentation and print it out and do whatever you need with that. So here's the changes, the big changes. For the United Healthcare, the Medical Mutual of Ohio, the SuperMed, and the Kaiser plan, everything except for Metro Health, this is what you're going to have. Where you currently don't have a deductible, you're going to have a $250 deductible for single persons and $500 for family. Where you currently are covered at 100% right off the bat, you're going to have a 90% coverage after that deductible is satisfied, and you're going to be responsible for 10% up to a maximum of $1,500 for a single person and $3,000 for a family. Your primary care physician copays will be $15. Your specialists will be $25. Your retail and mail order prescription drug plans change a little bit, but not very much, not very drastically. Now here's what I want to make clear before we go on, and I want to make sure everybody understands this. Your deductible for $500 for a family, it's real simple if you're a single person. You're electing this, you're going to have a $250 deductible. After that, 90% of your insurance is going to kick in, up to $1,500. After that, you're insured for 100%. But here's what I want to talk about on the family. On the family, we have what is called an embedded deductible. And what that means is that, say, Mike Smotek has 7 children. Not far from there, and so there's 9 people on his family plan, and he has a $500 deductible. If Mike drops a tire iron on his foot on January 5th and has to go to the hospital and he's got a broken foot, Mike's going to get a bill from the hospital for about $10,000, let's say, for a broken foot. Maybe $5,000, not too drastic. Because he's on a family plan, he does have a $500 deductible, but because he's only one person inside that plan, the amount of the deductible that he's going to pay for that visit or that incident is only going to be $250. So what I'm saying is, inside of the family plan, the most any one person can satisfy of that $500 deductible is $250. So you can look at it this way. If you have 9 people on a family plan and only one person uses it all year long, you're only paying $250 in deductible. It takes more than one person in the family to satisfy the $500. Now, it can be done in any combination after that, but one person is only going to be charged up to $250 on that deductible, okay? And we'll show some examples of this in a little bit. So, also in that out-of-pocket cost, that's $3,000 for a family. It's real simple for the single people. It's $1,500. For the family, again, if we have a family of 9 who's on this plan and they've got a $3,000 out-of-pocket, one person in that family is only going to be able to satisfy half of that with an incident, $1,500. This guards against you ever getting a bill in the mail for the whole amount. Do you see? So it's a little bit better for you. So that is the plan. That is the new plan under all of them except for Metro Health. So let's talk a little bit about how a deductible plan works. And I have to be honest with you, I don't much care for this scenario or this slide, so maybe I'll change it up a little bit. But John Doe has family coverage for his wife, Sally, and his no-name daughter with SuperMed MMO. So the family annual deductible, as we just saw, is $500. In January, John goes and gets an x-ray for $300. So right away, John has satisfied his portion of the deductible. John won't be charged for any more of that $500 deductible. He's satisfied the $250. Sally gets crutches for $100 and an insulin pump for $150. Now Sally has satisfied the other $250 of that $500 deductible. They're finished paying deductible now. So the total is $500, which satisfies the entire family deductible. The maximum that any one person could be charged was $250, which they were each charged, and then they're done. So, important to keep in mind, too, the differences. The deductible is that expense that comes first. The out-of-pocket is what you're working up to after you've satisfied the deductible, and you're paying 10% of those costs thereafter up to your out-of-pocket amount. The other thing I want to mention is that your copays when you go to the doctor, your $20 copay this year, $15 copay next year for your primary care physician, they do not go towards the deductible either, or the out-of-pocket expense. And this is all per federal law, Internal Revenue Service law, on how healthcare is managed. So, let's talk a little bit more about that too, because I want to be clear about other things. Healthcare reform, if you recall last year, and we told you in these presentations last year, healthcare reform said that when you go for preventative appointments, you are no longer responsible for a copay or any of the costs. And that is still true here. So for all of your preventative appointments, even in 2012 and beyond, they're going to be at no cost to you. So when you take your children to those well-child visits, or when you go for a mammogram, or for your physical, or what have you, those are no cost to you. But also, let's talk about this. I get sinus infections all the time, and they hang around for 2 weeks, and then I figure I better go to the doctor and get that antibiotic because I'm not going to kick it by myself. That's not going to cost me anything either. The reason why is because what goes towards your deductible and out-of-pocket are procedures, like when Mike drops the tire iron on his foot and goes to the hospital, or something like that. Now, a lot of people have been asking me, what about these allergy shots I go to the doctor and get? What about, this and that I actually go to the doctor and get? And my answer to them is you need to check with your plan. And the plan descriptions are all on my HR if you click on benefits. They're right there for you to see. And you might even have to contact a provider, the provider that you choose, be it United Healthcare, Medical, Mutual, or whomever, because you want to ask them that question. We don't know, for instance, if I go in for an allergy treatment every 3 months, or I blow up like a balloon, Is that considered a procedure, or is that just considered an office visit? That's between that doctor and that contract with that plan. So that's a question for them. But procedures are the things that cost you in deductible and coinsurance, not those regular doctor's appointments. All right, I want to be real clear about that. Those regular doctor's appointments, you are paying your copay still. All right, so we're still with John Doe and his family. The family annual deductible now of $500 has been satisfied. So now their benefit of 90% insurance kicks in. So now they go on in the year, this poor family who has so much problems here, costs incurred for a sleep apnea monitor that costs $1,000. The plan pays $900, and John Doe pays $100. And the $100 goes against that $3,000 family out-of-pocket maximum. So, and again, a reminder that copays and the routine prescriptions do not go towards the deductible or the out-of-pocket. And also, with the prescriptions, you have to get to know your plan and get to know what they consider that to be. So, that's how that works. There's a change in one of the plans that we have had for the last 3 years, and we called it our 90/70 plan. It was one of the United Healthcare plans that we offered. Only 103 people in the county took that plan, so odds are I probably don't have any of you sitting in this room. But if you are any of the 103 people that actually took this plan sitting in this room, your plan benefits are changing as well, up to a $500 for single and $1,000 for family deductible, 70% insurance, up to $3,000 and $6,000, and then you are also 70% covered for the out-of-pocket. So, and your prescriptions change there a little bit, but there's only 103 people who this actually pertains to if they so choose to choose that plan again. So, and this is actually the explanation that I just gave you on that plan for those 103 people. So, healthcare reform changes, and these happened last year, so you probably remember this. Dependents up to age 26 can be added to your plan. They don't have to be a full-time student, and they can be married or unmarried, but we won't cover their spouse or their dependents. And that's because of the federal law. And then the state of Ohio passed another law saying that they could do better, and they said, we'll cover you up to the age of 28. You have to be a resident of Ohio, or if you're outside of Ohio, a full-time student. You cannot be married. You cannot have coverage available at a job. And employees will pay a separate fee, which will be disclosed at open enrollment in order to add the 26 to 28-year-old dependents. Because the state law determined that the employee can pay the cost of covering those dependents, so that's what you're going to find out if you want to enroll a 27-year-old. You can find out when you're actually doing your open enrollment how much that's going to cost you, and also you want to be aware of the tax ramifications of that. It does have connected with it what we call imputed income, which means that you're going to be given an additional tax for this benefit in your paycheck. So that is, and that started last year, so I think people are pretty familiar with that. Now, I want to talk to you about a program that we have devised to kind of help you work down your deductible. So for single persons, you're going to have that $250 deductible. For families, you're going to have that $500 deductible. However, the county is putting into place something that will help you to earn that down without paying for it yourself. The county is electing to have a wellness incentive program, and what that is, and we're still out for bid on that right now, what that is a computer program by which you can enter information in there and it will be verified. And if you've done certain healthy habits, we will give you points which will go against your deductible. So if you have a $500 family deductible and I'm the employee and I go and I fill out my health risk assessment on this program, and I go to my doctor and I get all of my biometric screenings, which is what you go and get when you're getting a physical, and if I do not smoke, I can earn that deductible back. I can, basically what it is not have to pay that deductible. So, for those of you who select Metro Health, remember you were getting that $300 incentive per year to select Metro Health. You were getting $150 in the first half of the year and $150 in the second half of the year. You're not going to be given that right off the bat anymore. You are going to have to complete these healthy habits to earn that. So, the points you get in your health reimbursement account turn into cash that will apply against your deductible for you. So if you can earn all of that down, if you don't smoke and if you do those healthy activities, you won't actually have a deductible to pay. So if you don't earn it down, you will be responsible for the deductible that you have to pay. So we are in the process of selecting that wellness program or platform. It will be HIPAA compliant, which to all of you means that none of us will be looking at your personal information. I won't be able to look up to see who's smoking and who's not smoking and who, has the good blood pressure and who doesn't. That will not be available to us at the county at all. It will be web-based, and it will calculate and keep track of those points that you earn for healthy behaviors, and it will put it towards your deductible. So that's a very important thing. So again, Metro Health, you're earning those wellness points for your incentive, and then people who choose the providers other than Metro Health, you are earning those points to earn down that deductible. So the reason why I mention non-smoking is because, I don't know if anybody noticed, but August 1st, we started having smoking cessation programs across the county. We had all of our providers come in, United Healthcare, Metro Health, MMO, all of them came in, and it's still going on. I think we just sent out another schedule today, I think. We've had smoking cessation classes all across the county because we want you to quit smoking, and we have also been offering 2 months of any smoking cessation product for free, and that's any product of your choice. So if you want to go to your doctor and get a prescription for Chantix or some other stop smoking prescription, you can do that and the county will pay 2 months worth of that. If you want to go and get the nicotine patch, you can go and buy 2 months worth of that and the county will reimburse you for that. Or the gum, which is over the counter, or the lozenges, or any other thing that you want to use as an aid to stop smoking, the county will pay for 2 months of it. And right now, we're not asking even that you prove that you quit smoking. We just want you to try to quit smoking. So the reason for that is because, number one, it does cut down on our health expenses here in Cuyahoga County. Number two, the administration is committed to having a healthy workforce and offering programs that will help the workforce to become more healthy. But also because January 1st, Cuyahoga County is changing to a non-smoking campus, which means that in every building and around every building in the county, there will be no smoking at all. And if we are caught smoking on the premises of Cuyahoga County starting January 1st, we will be given a ticket by our protective services officers. Usually people laugh when I say that. Every single session, people laugh when I say that. But you will be given if you're caught smoking, you'll be given a ticket by the protective services officers. Those tickets are not for you to pay. Those tickets actually go against progressive discipline because now you're breaking a rule, the policy of not smoking in Cuyahoga County, and so that will work towards progressive discipline. So that's a little bit about what's going on with that. Usually a lot of chatter after that one, I know. That's a big bombshell there. So, I'm going to take questions after, Jay, if you could just remember. So, we have the flexible spending accounts. Remember I said if you elect a flexible spending account, you have to go online and do that every year. They don't just roll over. You have to go elect them again. This is a way to set aside dollars pre-tax to pay for any deductible that you're not going to earn through wellness, or for co-pays, or for prescription, or for dental and vision expenses. And I know this is really good if anybody's kids need braces. You really want to take advantage of this. The maximum annual contribution is $2,080. That's $192 per pay. And that can be taken out pre-tax, and it really does lower your taxable income. So I know that is a really good benefit. Also, if you don't get benefits with Cuyahoga County, so if you are one of the people who decline the medical benefits and the prescription benefits and the eye, vision, and dental, you can still elect to get flexible spending accounts through us. So go ahead and do that. It's a real nice benefit. There are two types of flexible spending accounts. There's a medical spending account and a dependent care spending account. If you elect the medical spending account, you can also elect to have a debit card sent to you so that you can just go ahead and use that for your purchases. The dependent care savings account, of course, spending account does not have a debit card. You need to be careful, though, and really kind of calculate how much you think that your medical and dependent care expenses will be every year, and you make sure that you spend that, because if you don't, you're losing that money, and we're keeping it, because that's what the law says to do. So you want to be sure and spend that every year. Spend what you put in there. The flexible spending accounts, again, are to pay your daycare needs for children 12 years of age and older, because the law states that, I guess if they're 13, they can stay home alone. So this is a good way to get a really good tax break on those dependent care spending. We do have a transportation pre-tax benefit. So if any of you have an RTA pass or pay for a parking space at Cuyahoga County, you can sign up to have that taken out pre-tax from your paycheck, and that gives you a tax break as well. So everybody's probably pretty familiar with our voluntary benefits that we provide. We have life insurance, accidental death and dismemberment, critical illness, and short-term disability. And when you go through open enrollment, you will be able to elect those things by clicking on a button. But actually what you're doing during open enrollment, when you're in there and you click on that button that you are interested in voluntary benefits, is you are actually sending your information, like your name and your phone number and your address, to the company Unum, who does this for us. And I want to talk about that for just a minute. See Unum down there at the corner? They're then going to contact you after they get your information and call you and check out what it is that you're interested in. And here's the reason why. Because these benefits are not Cuyahoga County benefits. They are benefits that we have contracted with this provider, Unum, to offer you above and beyond what we offer you in the way of life insurance and life insurance for your family, short-term disability, this kind of thing. What I want to make clear, and the issues that we have with this all the time, is that in human resources in our benefits division, there is nothing that we can do for these benefits for you. Meaning, when you enroll for these benefits, and when you enroll, really, you're just, on open enrollment, you're just basically telling a Unum representative to give you a call because you're interested in these benefits. But if you do elect to have benefits with them, the only thing that we're doing for you here at Cuyahoga County is taking the deduction out of your paycheck and delivering it to Unum. That's all we do. We cannot start your policy. We cannot stop your policy. We cannot change the amount of your policy. We cannot do anything else for you. And I'm sure some of you over the years here have probably called the benefits office saying, I stopped my Unum contract 2 months ago and it's still coming out of my paycheck. Well, that may be the case, but unfortunately there's nothing we can do about it. You need to contact Unum because they're the ones who contact us and say, stop this, they canceled. We cannot do anything with these except for take that deduction out of your paycheck and pay the company. You need to know that you're dealing directly with Unum when you elect these benefits, okay? That's very important. So, you'll see if you'll enroll online, click on that button, and they will contact you from Unum. So, open enrollment, again, started yesterday, October 31st, and runs through November 18th. Everyone must go on, every single person, even if you are not electing to have benefits with us here at the county of any kind, you still have to go on and decline that. You need to print your confirmation. If you don't have your confirmation and you come to us in January or even after December 6th, which is when we stop taking appeals, we will have an appeals period And if you come to us and say, look, it says this, but I have this confirmation statement that says this, we're going to take issue with that. After it, if you come to us, and especially if you don't have a confirmation, if you do not have your confirmation sheet, we are going to say, I'm sorry, there's nothing we can do for you. And you'll be paying for whatever that was for the rest of the year. So, try not to mob me now. Charity Choice is online as well. At the same time, you can go on there and make your charitable selections. And now, if you have any questions, I will take them.